everyone, Dr. Avalos here. I am going to welcome first to the Addictions Counseling course. This course is a requirement for both the school counseling, if you're getting your LPA, and the clinical mental health program. So the content will be expected to have it on the national exam. So let's talk specifically about this class, some general information that you'll need to know in regards to taking classes with me. We'll talk about your text, communication, and then we'll talk a little bit about the content that you're actually going to be covering in this particular class. The standards that we're using are national standards, as well as the incorporation of state. Although there's not too many. National tends to be a little bit a wider variety, but we will meet those through assignments, have measures in regards to all of your assignments, so that you are comfortable with the knowledge that you'll be getting what you need in this class. So first, let me cover some general information that I want to make sure that you're aware of when you take a class with me that's online, all right? Read the syllabus. You have got to read the syllabus. It's not just about assignments and when they're due. Those assignments go into detail. There's policy. There's a phone number you call when you have a problem with your computer, because I'm barely trying to figure out how to use mine. So I don't see this student version of what's on Canvas, so you can ask me where you might need to look and I can help generally speaking. But if you have an issue in regards to the fact that your document won't load, you've lost something, you're probably going to be able to get quicker help if you contact the help desk directly. All of that information you'll find in the syllabus. You'll find your required in regards to the objectives for the course, what it is at the end of this class that you will have learned, that you will be able to do. What text, which ones are required. I talked to you about APA format. The rubrics are provided in regards to how your assignments will be graded. So let's kind of talk a little bit about those things, but please read it. It'll give you information on the class that normally we could cover in face-to-face and that I could go with you through the syllabus. But because we're sort of like this, you have to take a look at what those specific areas that you may not be aware of if you're just looking at what is this assignment and when is it due, which is very important, but it's not the only thing. On your syllabus, you're going to see that there is an online face-to-face component, which means because this is an online class, we don't have a class time in which we meet face-to-face. There are some learners who like to have the conversation. I can't tell you the stories of working with people who suffer from addiction use. I can't tell you experience. I can't clarify issues immediately that we maybe would be able to cover. So what I've done is I'm including a face-to-face component that will be done in conferencing through Canvas. I will send y'all individual invitations for every conference session. This doesn't mean that you're required to attend every conference session. What this means is that there will be a designated time every week that I'll be able to talk to you about assignments, ask questions about assignments or content, to elaborate if need be, to clarify, to do those kind of fun things that we don't always get to do in online classes. I have kind of set a short time apart, so I will be there, Canvas will be on, I'll be sitting here waiting, and should something come up that you really, really want to talk about or that you just want to check in, please don't hesitate to come, okay? Those will be coming out quickly. In regards to communication and feedback for my online classes, for most students who've had me online or even in the counseling program, you know that I'm very quick to respond to email. I usually try and do it within the same day, no later than 24 hours, unless it's like some huge project that I've got to do with you. But most of the time, I've just really gotten questions specific about course assignments. You can do that individually, but also bring them to the conference area so that the conference sessions, in case you're your classmates, it's kind of nice to answer those questions all at once than individually with every student, but you know I will. What I want to make sure in regards to communication is that you're aware of when these assignments are due, and note that if you have questions about assignments, you need to ask early enough so that I can answer them quickly. For example, In some classes, I have assignments due on Wednesdays. Luckily, we'll be visiting with each other online that I can answer some questions. But if you wait till the last day, you wait till 2 days before coming in to see me during the work week, I can't guarantee you that I'll be answering questions over the weekend. So sometimes we have family things, sometimes we have conferences, and sometimes a girl just needs to take a break. So please be sure that if you're going to be gone, if you're having questions about assignments, ask. Even more importantly, read the instructions for the assignments and the information in the syllabus as soon as possible. It doesn't make sense to, if you have a large project that you haven't sort of reviewed what that assignment is about, and you wait for a few days before. Well, some assignments will require more thinking, thorough reflection, research, etc. So what you'll have noticed is that your first set of assignments were due within a week. After this, your assignments are due every 2 weeks. So people are usually like, yes, I don't have to do things for 2 weeks, and that's not the case. Some of your assignments, the majority of them, because I want them to be reflective, they're deeper, they require more. Some of them may actually require thought through the entire course, through the entire semester, for you to begin thinking, for you to be doing research, etc. So please be sure that you note that I've given you the time of the 2 weeks to allow for reflection, to allow for research. As you know, in most classes, the bigger projects require more time. With the 2 weeks, you can do the chapter questions earlier in the first week and then have another week to continue to work on a paper, a presentation, etc. You'll even see during the weeks where you'll have an examination, the exams and the assignment are due at the same time, but what you might do is finish one of the assignments or the easier assignment quicker, and then give yourself more time to study rather than trying to do both the assignment and the exam on the same weekend or the couple of days before the assignment. If you are someone who, if your assignments are due in the middle of the week, which in some classes I do, I want to make sure that if I have students in multiple classes with me, that everything is not due on the same day. It gives me time to grade in between the time that other ones come, but then it also, you don't have three to four more assignments due on the same day of the same week. So take notice of that. So make sure that you read everything. There are course policies, etc. I've talked about communication in regards to feedback and grading. The College of Education allows 2 weeks for grading. So sometimes some of the longer written assignments, I have read everybody's assignment and provided notes before I actually assign a grade, because I want to read through all of it. What are the expectations? What was said? What was missing? It's honestly a way to see of not only how my students are doing, are there pieces missing that I have not, that I need to maybe explain more thoroughly the next time I write this assignment, etc. So I do that for my sort of purposes, but know that your grade will be posted within the second weeks. I'm trying to get them done a little bit earlier now that I have the video situation corrected. So be sure when you get your grades. What I've had early on especially is students may not follow the instructions correctly. For example, some people are unaware of what I expect in regards to chapter questions, or some people think don't put a title page, or they put an abstract when they don't need to. And for the first couple assignments, I may give you feedback showing you, please don't forget, but I don't grade you as harshly because I'm trying to give you time to learn. For those of y'all who've been in my classes before, you know what the expectations are, so just do it from the earlier bat. But if you're looking at your grade and think, okay, I'm happy, but not actually looking on the assignment where there's comments specifically on your assignment that you've submitted, you might be missing something. And then in subsequent assignments, when I start going, okay, I've told them for 2 weeks, and you get your grade that's low, people are like completely shocked. Make sure that even when you make an A, even when you make like a 99, there are probably comments on your papers. So please read them just to make sure that in subsequent assignments you do better. Also, there are some students that because of the semester, we may have a parent whose kid is graduating from high school, they've got to be gone for work for a particular week. Some people will go ahead of schedule and start working ahead. Note that you need to be able to be sure that you're back in the discussion conversations during the week that you're supposed to be discussing it, and also that you give me a couple of modules to correct if there's anything to correct, so that the rest of your assignments you can make sure that those components are corrected. I've had some students go really far ahead, and then by the time they come back and look at the feedback from the modules 1 and 2, they're frustrated because they're going to go back and change things for assignments they've submitted, let's say for 3 and 4. So if I would, let's get through the first couple of modules. There's different assignments. You can see what the expectations and the feedback is, and then you can push forward. I respect your time and know that everybody has things that have to happen, myself included. So just give us a little time to make sure that you do, you know what the expectations are, and we'll do the best possible. Okay. So so that kind of feedback, make sure that you read your the comments. Let me make sure I don't forget everything else. So this class is new. This is the first time we've offered it here at UTBB in our program for both counseling and counseling psychology students. There were a variety of textbooks out there, and I was trying to find something that would meet the national and state requirements fairly easily, and we found that in this book, which just happens to match almost everything I own. Yes, it's purple, but the content is from Pearson. I love Pearson. Our authors, Patricia Stevens, is actually a retired counselor educator, so I love the fact that the types of discussion questions or reflections or case studies or even messages in the field for people who are addictions counselors, she puts those components in because she realizes as an educator how important it is, as well as Robert Smith, who is a current professor in counselor education at Texas A&M University, Corpus Christi, obviously where he teaches the content and knows what our students need at this particular point. So you really, really got good authors here who've done a really, really good job in regards to what we need for this class. So I will be providing videos for the modules. If you've looked online, which most of y'all have, you'll see that I have Canvas set up so that they look almost exactly like what you'll see in the course schedule, so that you don't have to search for specific assignments. I will have the module, I will have the assignments that are due, you'll see them, but what's super, super important is there is a folder where I will indicate that there's module information in there. You should read that. Okay, make sure you open that file first, and often it will say start here and have module information on it. In that particular module, it'll tell you what chapters we're reading, what assignments will be due. There are PowerPoints, and I will be providing videos as well for each of the modules. Most of the time, the modules are already inside this folder. If they're not inside this folder, I have provided a link to my YouTube channel for you to watch them there. So just make sure you go to that folder. The due dates are provided for you in Canvas so that you know when they're ready. I do not open or close assignments except for the exams. And the way exams will work in this class is, for some of y'all who've been through our program, you know that not all of us have offered exams. Sometimes that's because of the depth of learning that you have to have, because of the fact that sometimes short answer and multiple choice can't give you that. But we've made a decision programmatically to start including at least 2 exams in every class, and let me explain why. We're doing this, of course, so that we can assess your basic knowledge of content, but also because we are going to make sure that the content of the question and the format of the questions will be very similar to the types of questions you'll be answering on your state and national examinations. So it's good practice. I think it's good to help teach you that this is the way the questions will be. They're all multiple choice on the national and state exams. So trying to find ways to help you become more familiar with what is the content I'm missing, what am I understanding a little bit better or not. how am I doing in regards to answering questions that are recall, comprehension, and application in their format. So you'll at least get some practice, and we can work on that here rather than waiting till later when you have to pay for it. I will be providing additional videos for y'all. I'll give you links to those as well about each assignment. For example, the chapter questions. If you haven't taken classes with me before, you're sort of like, you can read the instructions, but then some people it's a hit or miss in regards to, do they just answer the question and that's right? Well, it's kind of right, but it's not a graduate school answer, and it's not telling me that you know how to apply this information, not only in your own words, but tell me what it looks like in the real world, because that's what's important. In regards to content, we can continue to learn, we can use our books, we can use our notes, we can look up articles when we're actually out in the field and have graduated. But for here, I need to know that you know how to take that content and make it real in the real world, if that makes sense. So I'll have videos for them. You're going to have some assignments that you're going to need to pay attention to over the course of the semester, so make sure you've read those. And of course, we'll always be able to talk about those, and I can answer questions during our conferencing. So let me talk to you a little bit about the content of what we're going to learn. So pay attention to the title of the book and the terms that are used. Not even 5, 6, 7 years ago, definitely when I was in school 100 years ago, we called substance abuse, in that it's abuse. Pay attention to the new name. It's called substance use disorder. What can you think would be the purpose to change that? What we've learned, what we are going to continue to learn, is that the name is very much important. The term abuse implies a variety of different things. The term can also influence theory in regards to why people use drugs, prescribed or otherwise. Think about what that means. That there are theories out there that suggest that people who use drugs or abuse drugs are bad people. We're learning a lot, especially with the current opioid crisis, that that's not necessarily the case. And that everyday people, there are multiple factors that influence why they begin to overuse drugs or medications, etc. they've been given. There's also the change in the name is to have an effect on the overall idea of medications. I have worked with people over a long period of time that come with their own issues in regards to using medications. It means that I'm sick, it means that I'm weak, that I can't just make myself stop feeling this way, etc. Think about how abuse and that term impacts what we actually believe about the uses of medication. So when we're talking about substance use versus substance abuse, and then the term disorder, what is it that then makes that substance use is things that all of us will do? I take medication for blood pressure. It's because I have issues and I need to take care of the symptoms so I don't fall over dead right in the middle of class and traumatize all of y'all. But also, what about other medications? Is there a particular time that I could abuse the type of medication that I take for blood pressure? There's all sorts of reasons, and there's all sorts of ways that people do that. And so what the title is actually trying to tell us is to change the framework of how we regard the use of medications, make us be more self-reflective about that, self-aware of our beliefs in regards to what substance use means. And then also think a little bit about being more self-aware in regards to why you believe other people use medications. You'll learn a little bit more about the fact that there's not just one reason. And it's very interesting often when I work with clients or work with students who have a family member who has had a substance use problem where they've overused, that because you're so close, because you're part of the family, there can be a lot of judgment and misunderstanding and issues with the family based on how you view. And of course, that comes from all those things that we've learned. How does the media, what does the media tell us about medications? What do they tell us about various substances? What do people look like in the movies who are selling or using substances or medications? How are they in regards to the main population? Are they considered criminals? Are they considered weak? What are those things that occur in the media that influence us in regards to what we think about people who need or use medications, which are also AKA substances, right? And medications, whether they're illegal use or they're over-the-counter use or they're prescribed uses, they are all substances in which change our body, our brains, etc., to either minimize, stimulate, and can potentially change health and behavior. So think about those concepts as you go through this. Now, based on this media, and then again, the myth part of what has our family taught us about people who have overused or used substances as they shouldn't. What does your family teach you? Part of my family, I've told y'all, with my brother, he just thinks, we don't need counselors. If you're feeling depressed, just stop it. It's just mind over matter, you just quit. So if that is his black and white kind of thinking, how do you think he might respond or believe about someone in my family, on the streets, family, friends, kids, etc., that may be using drugs inappropriately? What does that mean? You just stop it. So through this particular class, you're going to find that there are a variety of factors as to why people begin the use of substances, why they continue to use substances, what happens to their body, what are the chemical changes, what are the impacts on different types of substances, and what kind of may be the multiple factors where someone crosses that tiny line into the disorder of where it affects their daily life, it interferes with their functioning, and it can cause great distress. What are those? And could they just be this fine line? You'll find some theorists that talk about the socioeconomic or sociocultural impact of you'll find families where kids start using drugs at early ages because their parents use it and it's there, and so the culture is just that's just part of what happens. So those theorists who kind of use Vygotsky's or Bronfenbrenner's socio-ecological approaches. You'll also see that medical model of that there are people who believe that we are wired genetically for developing substance use disorders. For example, there's a belief in the gene for alcoholism that over time, the body, the family, the genetics changes to where people are predisposed for certain illnesses. Well, let's think about what that might mean. If you're someone who's diabetic and you have children, what's the likelihood that your child may just be a carrier of a gene? And then what are the factors that may influence the exactual outward appearance of having the gene? So you have your genotype of what my genes may be made up with, and then the phenotype of what actually occurs in the real world that people can see. So you'll learn a little bit about that and what happens in the body that creates a tolerance where people who may use a substance, that particular level is not enough and you have to increase it. There's a gentleman who is a neurologist in New Braunfels, Texas, that I take my mom to, who exhibits signs and symptoms of Parkinson's, but she doesn't have Parkinson's, it's just a benign tremor. And over the years, it's been really interesting to watch not only her build a tolerance for this specific medication. After she takes it for a while, she has to increase to get the same effect. But then there are also cognitive symptoms that might occur because of taking the medications that before were not even apparent, but now because of the increased need of this medicine, it's beginning to affect other things outwardly in her function. So that's sort of one of the things. So in regards to tolerance, and then also withdrawal, what happens to the body when you stop taking medications that you've taken before? Sometimes you can have a rebound effect where the symptoms you just exacerbate and then they'll begin to wane. For some medications, for some substances, withdrawals can cause death because the body will go into shock. We've given it the help of stimulating or inhibiting chemicals in our body. And if you've taken it over a long period of time and you have to increase it, that's not necessarily a bad thing, but sudden stopping or cessation of use can actually have significance and in a few areas, life-threatening consequences. So we'll be talking about all of those in the various chapters, so that'll be great. Additional content will be, so then if I have all of this information, what does it mean to me as a counselor? Not only the content is important, remember I want you to be able to use it. So if you had an individual come into your office and they had a substance use issue, then how would you treat this client? A lot of times, there are times that you have people with comorbid issues that are happening. This person could be depressed and they've developed alcoholism in an effort to combat the depression, not recognizing the actual impact that alcoholism has on the body. But they may not tell you about the alcoholism. You may never even know about it until weeks and maybe months later. You have the client show up and they're drunk, they're intoxicated, they're behaving a certain way, and you're sort of like, what is this? And then you know. Or it's not until they have you've developed a strong relationship that they're going to feel comfortable enough to talk to you about these substance use issues. You're also going to learn about the ethical and legal issues in regards to working with people with addiction issues. It can be so confusing because the variety of ethical codes that exist out there that will tell us we must keep people safe, but when it's drug use, we can't get them in trouble. So there's going to be some real sort of like, can someone just tell me what the black and white answers are? And as always, there's multiple factors that will influence the decisions that you make. Even more importantly is then the use of your consultant, a supervisor, etc., to be able to talk through some particular decisions in a treatment planning. As with most of my classes, your assignments will be developed to enhance the material, to give you perspective, and to provide a framework for you to begin to understand how do you bring the component of addiction into your case conceptualizations and therapeutic treatment of your clients. Okay, so you'll have assignments to practice on those things. Like with other components, you'll be looking at, how do I work with an individual client? How do I do this in group? How do I work with this in regards to a family, and the impact of family on continual use and as well as relapse, which can happen with treatment of family to each other. So it's going to be some interesting things. You'll also find more about research on particular treatments that are specifically geared towards helping a population who are suffering from addiction issues and substance use disorder. So there'll be ones that we don't always use, but you'll see these and why the research says they may be more beneficial or not, based on the material that we've learned thus far on the various approaches. It's going to ask you to look at your theoretical framework of which you draw more connection to and say, so how is this content, how is it fitting into that theory? And then as not only that, what are some of these additional treatments that we may not have heard about yet and how they can be used within the context of theory? So there's a lot of cool things we're going to talk about. I want to make sure that I tell you, we're going to learn about assessment and treatment. Of course, assessment, how do we treat whether this is on the line further causing issues? And there's a variety of them out there that you're going to learn about. You're going to learn about different populations. For example, We talk about culture. There's use of different types of medications, substances, whether they're legal or illegal, through cultural groups, whether that occurs because of socioeconomic status, ethnicity, religion. Is it someone who is older, someone who has chronic pain? Is it someone who is a child or adolescent, and how that might affect their body when it may not affect an adult the same way because their body is done growing? So there's a lot of components to pay attention to when we're learning about addiction. So I'm excited to see what you learn, the questions that you have, the method of exploring, and the ideas of what you can actually do to work with your clients in a variety of settings, in a variety of contents, to help and assist in the treatment of their substance use disorder. I think that, and one of the other things that I almost forgot is that y'all are going to go through is homelessness. In the larger cities, even sometimes a small like ours, you'll find people who are homeless. And what are the things that we're learning, and what is that relationship with substance abuse disorder and comorbid type mental health illnesses that can occur and lead to homelessness? So, you've got some exciting stuff coming ahead. As I explained, you'll be receiving more videos, links to more videos, and I look forward to working with you. Please don't hesitate to ask questions about assignments or content, and let's get started. All right, thanks.